Yes,
Okay, good.
Dr. Smit, welcome. You will treat botulium toxin mesotherapy for the treatment of skin imperfections, pores, acne scars, and superficial wrinkles. Thank you to start, Dr. Smit.
You can do. Okay. Okay. Can they see on the screen? It's all good. Okay. So in this session, I'm going to focus on using mesobotulinum toxin. So what exactly is mesobotulinum toxin? So it means that we are using our botulinum toxin not in the traditional way of injecting in the muscles, but we are actually injecting intradermal. Now, intradermal botulinum toxin has got many scientific studies that have shown it to be effective on skin quality, especially effective on enlarged pores, even acne patients, rosacea patients, also for patients that are sweating a lot on the forehead or even on the upper lip, menopausal patients, and then also helping a lot with redness, especially your typical like telangiectasia and rosacea patients. It is also a solution for sebaceous problems. So that would be oily skin, pores, acne. And this is obviously not on label according to all of the toxin companies that are registered. It's an off-label use, but it's an academic use because there are many publications to support it. So I'm going to show you how I dilute it to make it also possible to use your toxin also for other indications in the same session. It's very important when we do mesobotulinum toxin, we can do the whole face, we can do the neck region, but there's some areas that we have to avoid when we use the mixture of the toxin. Be very careful of this directly under eye region. This is an area where the orbicularis oculi has a very important pumping action. And this pumping action is very important to keep the fat pads in place and not to cause any edema or lymphedema. So if we inject in this region, we're going to get puffy eyes. So our intradermal injection is safe everywhere except there. The other region to avoid with your mesotoxin is the first centimeter above the brow. So this area is quite important because you will definitely hit some fibers of frontalis and you could drop the brow. So this is also an area to be very cautious of and rather not to treat it. Then the other important area to be very, very careful when we do the mesotoxin is to avoid the depressor labii inferioris region, because this will give a very bad aesthetic appearance. Everywhere else on the face, you can do the toxin treatment, but these are kind of like the areas to be careful to inject it. Okay, so I'm going to show you my dilution. So I'm going to use a 300 unit vial Dysport. Okay, so 300 units of Dysport, you mix it with normal saline of 1.5 milliliter. Don't know if you can see it clearly on, maybe I can show it on my hand. Okay, 1.5 milliliters. Okay, so you add the 1.5 mils into the 300 unit vial. Then you need 50 units drawn up. Now, when you use your insulin syringes, you will notice all the insulin syringes is marked according to insulin units. When you use 1.5 mil saline in 300 units Dysport, or even if you use the 500 unit vial Dysport mixed with 2.5 mil, then everything that you see on the insulin syringe is just double it, and you know exactly how much Dysport you have inside. So it means that 5 is 10, 10 is 20, 30, 40, 50. So this is 50 units of Dysport. This will be the same even if you use a 1 mil syringe, which is not really recommended. So 10 would be 20. And if you need 50 units, you will need to go to 25. Okay, so you're clear on this. So everything on the insulin syringe, every 5 markings is 10 units. Okay, so every 0.1 milliliter is 20 units. So here we've got 50 units of Dysport. So to do mesobotulinum toxin, what is often used is just to double dilute it with saline. So you could take your 50 unit syringe, 50 units of Dysport, and draw up saline all the way. But what I do to get a better result even is I mix it with a polyrevitalizing cocktail solution, NCTF, which also is very good for the pores, for pigmentation, for hydration, for wrinkles. And then I put 50 units of Dysport that's already mixed that I add inside the 3 milliliter vial of NCTF. And then you have what is called the magic cocktail. So this is kind of like a magic cocktail that will treat pore size, small little wrinkles on the cheek, even around the eyes, small little wrinkles here, helpful pores, acne, rosacea, and can be used on the neck region also. But be cautious with this solution over this area, and that area. Okay, so then the administration of it, I'm going to draw up this 3.25 milliliters into the syringe. So this is just a normal 3 ml syringe. I just want to turn my hands around. And then because we know the technique is very important, we're going to use the smallest possible needle. So I'm going to use a mesotherapy needle of 32 gauge 4 millimeters. And then it's very important. So now we have this cocktail, this Méso Dysport cocktail, that will really give a lot of medical problems a good solution, as well as aesthetic problems such as small little wrinkles. So obviously if the patient is here for acne treatment or oiliness, you will focus on those areas, or for enlarged pores, we know we need to really focus. In this case, this patient really wants to improve the pores as well as pigmentation, improve the small little wrinkles all around, and still get a very natural result. She doesn't want to have a very tight appearance with no movement, and this solution gives you a very good result in this way because it gives much more subtle results. Often I would then combine it at the same time with using my Dysport in the normal dilution to treat the glabellar wrinkles, because this won't be sufficient for the glabellar wrinkles, and you might even do some touch up around the eyes or other muscles. Okay, so now the technique of Méso Dysport. The technique is very important to be very superficial and intradermal. So let me maybe start around the eyes just to show you very nicely. We insert the 32 gauge 4 millimeter needle and make small little intradermal blebs. So you need to see the blanching of the skin. If we're going to be deeper, then we're not doing Méso Dysport or Méso toxin or whichever name you want to call it. Then you are injecting in the muscle, but this is intradermal injection. And the intradermal injections is the one that will help for sweating, for pores, for acne, rosacea, and sebaceous activity, as well as some Asian studies have shown that it gives a skin tightening effect. And this was the first publication that was really quite remarkable, that convinced a lot of doctors, was by Dr. Wu, Dr. Waffles Wu, that actually started experimenting with this. So in her, I'm focusing especially over the pore size area, so the large pores to improve it. This can obviously also be done on the nose area. You will notice that the skin around on the nose is very thick. It's much more difficult to really get nice blebs, but it really helps a lot for a very sebaceous nose with large pores. But you need to concentrate a little bit more on the depth of the injection. Okay, and then we don't wipe it off with a gauze because it's a magic cocktail that can penetrate into the skin. We basically just wipe it with our gloves into the skin. Now this can be done all over the whole region. We can do this area, especially where we see these little cheek wrinkles, and you can accentuate the wrinkles by making sure that you focus on those wrinkles, especially with your injections. You still okay, ça va? Okay. So it's a 32 gauge 4 millimeter needle. Also for the forehead, we know that publications has also shown that intradermal injections will also give you a good result on the forehead wrinkles. So even not going into the muscle but intradermal, we're also going to get rid of the forehead wrinkles that will give a very good result for patients without dropping the brow. But you'll notice that I avoid the first 1 to 2 centimeters just above the brow, because we don't want to drop the brow, and the patient very nicely asked me to make her look natural and not to look fake, and she still wants expression. And it's very important that we listen to our patient. Okay, I will finish the rest around the eyes, the same as that side. What I want to just show you also is the technique on the neck. On the neck, we must remember that the platysma muscle is very superficial, and it covers the jawline like a very thin sheet. We have skin, and then we have the platysma muscle, which is really superficial, causing very much these horizontal wrinkles. The platysma bands can be injected at the same time with normal Dysport dilution, but these horizontal wrinkles really works well with this magic formula of Dysport plus NCTF. And this also gives you a very natural, like the Nefertiti neck lift and improvement of the neckline. In my opinion, to cover everywhere where the platysma is. Remember the platysma, let me just take a marker here, runs all the way here, inserts into the mouth corner, and then into the SMAS, and then depresses downwards. So we really want to cover this whole area with your mesotoxin technique by being very superficial and getting this beautiful neck lift type of an effect. If the patient has got very strong platysma muscles and bands, like I said, then you treat it also separately with your normal dilution. But these little small blebs will not ever cause the complications of being too deep, of dysphagia or any swallowing problems or speech problems, because we are very superficial. And you focus a lot inside the wrinkles. And then really make sure to get also these superficial fibers of the platysma and the skin area. So I'll be covering this whole region, the same on the other side off camera. What I just want to quickly also show you is that in the same session, we can then also treat the intramuscular injections. So that I will be focusing on later in a demonstration, because it's really wishful thinking to think that the Méso Dysport is going to get rid of the frown wrinkles. So in the same session, you finish your whole Méso Dysport, and then at the end, after you've cleansed and massaged, then you do the deeper intramuscular. So I'm going to do here for her 10 units in the procerus muscle at a 45-degree angle. This is the direction of the muscle. Okay. 10 units in the corrugator. You'll see that I aim towards the depressor supercilii muscle and not towards the frontalis, because otherwise we drop the brow. This technique this way gives you a beautiful lift of the brow. Again, on the other side, I'm doing 10 units in the medial corrugator. The lateral corrugator, you look for the fold, so you push the skin, because this is where the corrugator inserts together with the frontalis and orbicularis oculi. We have this brow modiolus that causes the fold here, where our sleep line starts. And there I'm doing a superficial injection, putting my finger on the orbit to protect any spread towards the levator palpebri, and a slow injection. I'll show it again on the other side. So you can always locate the fold by just pushing. Then you know exactly where is the tail of the corrugator. Superficial in the direction of corrugator. Keep your finger on the orbit to stop any spread towards the levator palpebri muscle. And then obviously also at the same time, if you wanted to, you could do other muscles, such as a little bit more around the eyes, although I think this is going to give her a very natural result. But something that I really like to do, then is if they've got really strong platysma bands, then I will do additionally the points of the platysma muscle, like really get the patient to pull the platysma muscle, grab it and inject 5 units per point wherever you see the bands. If you do this together with your meso disc board, you get such a beautiful neckline of the patient. Okay, so I think that's that for my demonstration on the meso disc board. I'll just be finishing off camera the other side of the face, but if you've got any questions, you're really welcome to ask me if you've got questions.
Alors, par les téléphones, on devine déjà l'intérêt que tout le monde porte à la toxine botulinique. On voit tout le monde filmer. Et vous avez vu Promotion Maghreb, en fait, nous, on connaît Ipsen. C'est 10 portes. Il y a nombreux sont qui se demandent qui est Promotion Maghreb. C'est 10 portes. Donc, je les remercie d'avoir participé. Je les remercie pour tout ce qu'ils font pour nous. Beaucoup de workshops, vous le savez tous. Et je serai une ingrate si je ne cite pas M. Bni Khlef. Parce que ma première seringue de toxine, je l'ai prise avec M. Bni Khlef il y a plus de 20 ans. Donc, merci M. Bni Khlef de nous soutenir. Merci pour tout ce que vous faites pour les médecins. Et merci ce que vous avez fait pour moi. J'en profite pour le reconnaître publiquement. Donc, c'était 10 portes. C'était Ipsen pour nous. En fait, c'est Promotion Maghreb. Et je vous remercie. Merci, Dr Smit. Je laisse Zineb parler de ça. Donc voilà.
Thank you, Dr. Smith, for this amazing presentation and this technique. We will see if there is some question from the assistants. Est-ce qu'il y a des questions dans la salle pour la démonstration de Dr. Smith?
Tu sais, Zineb, nous avons 2 heures de décalage. Les questions vont prendre 1, 2 maximum, parce que nous avons 2 heures de décalage.
Une question, Dr. Kbej.
Est-ce qu'elle peut faire la séance et en même temps faire le mésobotox? C'est ça?
Oui, c'est ça.
Quelle séance?
La séance de botox et le...
Dr. Smith, there is one question.
Yes.
If can we make this mesotoxin with in the same time with the toxin injection?
Yes, that's exactly what I just demonstrated. Is I demonstrated that, maybe I can quickly come to the stage.
Zineb, il y a une question, si tu peux. C'est combien ça dure le mésobotox dure combien de temps?
The second question.
Okay.
You
So
asked
the
for.
first question is if you can do it in the same session. And yes, it's very important if you want to also treat your other toxin injections to do it in the same session. Because whenever we use botulinum toxin, even doesn't matter which brand, you have to always give a 3-month interval. You cannot do 1 month mesotoxin, the next month do glabella, the next month do hyperhidrosis. We have to put it all together in the same session. But whenever we use this for Botox, whichever you use, in the same session, you will always do your normal injections last because we don't want it to spread to other muscles. So if you want to do meso, you do it first, and then you do your glabella, lateral canthal lines, or whichever area. If you want to do peelings or lasers, you do it first, and at the end, you do your disc board injection.
Okay.
And the second question?
Yes.
was?
Second question. How many time duration for this long?
Okay.
It
So
can take.
usually, for the meso disc board, I would do it every 4 months. So every 4 months, you do the mixture of NCTF and disc board. In between the sessions, you can do every month plain NCTF, not mixed with disc board. So plain NCTF to make the skin very beautiful, and every 4 months, you do the mixture. 50 units of disc board inside the 3 milliliter flacon or vial of NCTF, and you do the mixture and you focus on the area for the patient.
There is another question. There is a question for the barcode, how to treat barcode with this.
Yes,
This-
you can treat the barcodes together at the same time. Also, more painful, but very good. Yes.
Another last question, maybe.
Yes, the same aftercare for 24 hours, no exercise, no massage of the face, no heat or steam. So it's the same aftercare. Yes, yes, just to improve the uptake. Yes.
Okay, thank you, Dr.
Thank you
Smith.
very
Thank you for your presentation.